Alrighty, guys, we are back from rehearsal just like that. It was a very busy rehearsal this time. I mean, with everything going on at rehearsal and how we had to stop, start, and everything, and with the storm approaching tomorrow, we don't really know what's gonna happen with the storm. So we're supposed to have rehearsal tomorrow and Monday. So I don't really know what's going to happen with that. So, and then I have an art class on Tuesday. And then I think we have rehearsal on Wednesday, I think. I'm not sure, but yeah, this is how my week's turning out so far. I'm just combing my hair. Sorry. I want to look somewhat presentable, somewhat not ridiculous. But yeah, I just wanted to get on here real quick and say that yes, I'm alive. I'm not dead. Thank you very much. Because a lot of you have been asking me, like, are you dead? I'm like, no, I'm alive. I just was wicked busy. Haven't had the opportunity to film today. But as soon as I had a second, I would pop on and say a big what's up. I am gonna invite my cousin to be with us because, I thought maybe she could shed some insight on some stuff for me. So I'm gonna do that. So yeah, it's been a long night to say the least. My computer did happen to break last night. The top of my cover came off here. But the computer itself still works in the meantime. So yeah, I had to get that, and so I was just like so stupid, but
So you have an iPad and you want to use it to make art, but you have no idea where to begin. Well, I'm so glad we found each other because I am here to...
Hey, Princess. Of course you can ask me a question. You can ask me anything. I love questions. What's this about? It's okay, don't be shy. Princess, I'm your daddy. You can share anything with me. Oh. Okay. So what does nonverbal mean for you? Well, because I don't know what that means. Okay. I think that could be fun. When did you want to do that? No time like the present. Okay, I got it. Okay, we can do a little space scene. I can put you in a onesie, in a diaper if you want. Okay. Well, how about starting now?
no more talking.
No more talking from Princess. Okay. So let's put you in a fresh
No more
diaper
talking.
and a onesie. So, where did I put the onesie? I know I put it here somewhere. Oh, here it is. Your daddy found it. Okay. Open wide. Oh, I forgot to wash it. Damn it. Baby girl, your daddy forgot to wash it. There you go. All clean. Open your mouth. Good girl. Okay, let's get you out of these clothes. How am I gonna do this? Let's bring one hand up. Okay.
God, I love this channel. Oh my god, I love that channel. Like I will watch that channel all day and all night. Oh my god.
Injury or potential. It looks like maybe his leg got caught underneath him and his knee might be problematic here. Here we go.
Rexner And assistant trainer Mark Bruce back out there. Bruce Bochy.
Oh, maybe it's an ankle injury. Remember, a lot of times when you're rolling an ankle, you're landing on an inversion injury. Usually in those instances, you have a sprain of a ligament or a tear of a ligament. But if it happens to be an eversion injury where your foot turns outside, there's a ligament on the inside there called a deltoid ligament. And that is so strong that it usually ends up ripping off a piece of bone, creating what's known as an avulsion fracture. Posey suffered a fractured fibula and torn ligaments on his ankle, requiring season-ending surgery. There's two bones in the lower foot. So on top you have the femur, on the bottom you have the tib fib, and the fib is on the outside. So it looks like he had an inversion injury, but it must have been so bad that there might have been a fracture from either an avulsion where the ligaments ripped off a piece of bone, or the ligaments tore, but then also there was contact that created a fracture as well. But also, Buster Posey went on to win Comeback Player of the Year, the National League MVP, and 2 World Series championships with the Giants. Impressive stuff. Oh! Hit by pitch. I mean, you could tell right by the pitcher's reaction that this was a complete accident.
And it caught him right and looked like up under the helmet.
Oh my God, that's a broken orbit. I'm so worried for the nerves. I'm so worried for the muscles.
Cheek.
Oh, yeah, that's a zygomatic arch fracture. That is recoverable, though, as long as no significant head trauma, meaning brain trauma, had occurred. Stanton suffered multiple facial fractures, dental damage, and cuts that needed stitches. On September 17th, the Marlins announced that Stanton would shut down the rest of the 2014 season. Wow, I mean, it's very difficult to see after an injury like that. There's lots of swelling. Also, probably hard from like a traumatic standpoint to get back up into the batter's box and face pitches flying at you 100+ miles an hour.
For a manager, all the buttons that you push, you're hoping for good things, and they just happen to happen that way.
Oh, did he catch it?
Half is on the ground. Molina comes in
I
to
thought he
score.
caught it.
Escobar scores.
I think he got hit at the side of the head there. It's so hard to see. It happens so quickly. It's so important to put patients on a brace like this to protect at least the cervical spine so that you don't move it when the spine itself is unprotected. Remember, the spine sits within a vertebral column that protects the spine. But now if there are fractures and loose bony fragments in that area, that could potentially create a severed spinal cord. And that's obviously very devastating because the higher up a spinal injury occurs, where you have, let's say, a complete tear, the more likely that you are to become further paralyzed and potentially to the point where it could be so high that it could be lethal. According to ESPN.com, had been placed on a 15-day disabled list with a skull fracture behind his left ear that doctors believe will heal on its own, as well as a sore right knee that he tweaked when he dropped to the ground. Wow, so there's a little area in the back of the skull here called the mastoid process. Not related to this, but what's interesting about the mastoid process is that if you have an ear infection, or let's say an inner ear infection, or a middle ear infection as we call it, if untreated, can actually progress in some instances to an osteomyelitis, which is an infection of the bone directly here in the mastoid process, which is why whenever we do an exam, we might feel this area to see if it is uniquely tender.
Ground ball right side. Chris Johnson's got it. Oh no, Jason Gurley is down.
Oh my God. That's the problem with a lot of these shoes. Whenever you're trying to change direction, they can get stuck in the ground.
He was hurting all the way over there.
Interesting. I wonder, there was no misstep.
He was hurting all the way
Was it
over.
a stress fracture that his foot looks pretty loose there. Atlanta Braves closer Jason Gurley suffered a torn Achilles while running to cover first base during the 9th inning against the Colorado Rockies. The issue with not having an intact Achilles is you have no control of your foot, so your foot's essentially dropped. When a patient comes in and if we want to see if the Achilles tendon is intact, you essentially squeeze the calf. And when you squeeze the calf, you should see the foot flex. And if you're not seeing that flexion and the foot moving from squeezing the calf muscle, that's considered a positive Thompson test. You would suspect that there is a tear, either a full tear or partial tear of the Achilles tendon.
Look in, get my sign.
Oh, one-handed pitcher?
In front of my body, I wanted to hide my grip. Worried about the third base coach, worried about the first base coach.
Oh, because he was worried about the coaches tipping off the player.
Set. Eyes still on the target.
I mean, his eyes were kind of on the ground there, but...
Back to the mound. He goes to second for 1 out.
Oh, he got the double play and all.
Here's Abbott now. He took Lieber to a full count in the second inning before going down on the strikeout. Line over the...
Wait, he's batting?
Jim Abbott's first
What?
He's gonna score a run, baby!
Dare I say he did that single-handedly?
With 3 men on. This one almost gets Reyes. Oh, Lackey.
Elbow
Does
injury.
not look good at all.
According to Pete Abraham of the Boston Globe, Lackey is suffering from a simple bicep strain rather than a more serious injury many had feared, just as I had feared. As you can see by the title, bicep, there's two muscles that actually form the biceps, and based on their attachments, it can create a strain when throwing a ball because of that torque and spin that you're trying to put on the ball. That's why a lot of movements like this, which we call supination, require the strength of the biceps. And part of our special test that we do to check the long head of the biceps tendon up here in the shoulder requires us to make use of the supination motion.
Top pop. Ramirez gets rid of it quickly. Oh, no.
Oh my God! Anytime you have neck hyperextension, you start threatening the arteries in your neck. Most likely to be injured here are the vertebral arteries in the back of the neck that run on either end of the spine. I mean, you also have the carotids that just so much can go wrong there.
Ramirez had to get rid of it quickly because he knew Lewis runs well.
Thank goodness his outstretched hands took some of the force. And yes, I know it still was a bad injury, but it could have been a lot worse.
He landed on his head. Royce Lewis appears to be okay now.
He's okay? Incredible. I mean, the momentum must have carried him perfectly, but there had to have been some kind of strain on the anterior scalenes. At least the sternocleidomastoid, a muscle that attaches from the sternum, clavicle, mastoid, the mastoid process right here. It's the muscle that attaches here. So imagine if it pulls on it, that's the kind of motion that it does.
Off the end of the bat into short center field.
Short pop fly.
Damian Jackson going out.
Oh my God.
And the ball is dropped. Throw into second, and they still got the runner.
Wow.
Wow, we were winning 4-2 against Oakland. We were winning 4-2.
Call it. I have been a witness to these types of head-on collisions during soccer matches where both people went up for a header, and that clunk, that sound, nothing can prepare you for hearing two skulls just crack against each other. And even the injury is initial when they bump into each other, but then when their heads hit the ground, that's also the secondary injury that could be equally as problematic, if not more. You got to remember, the brain sits in a soup, so when you rattle it one way, it's going to come back the other way. It's called a counter-coup injury. Johnny Damon was on the ground for 9 minutes before taking off. He had a significant concussion, but was alert, awake when he was taken to Highland Hospital. Thank goodness, because those types of injuries can become really problematic. There's all sorts of bleeds that can happen in the brain, both epidural and subdural, depending on which layer above the brain is bleeding. So very lucky that this turned out this way.
Alan, for years, the Giants held out.
Sam, you just put Giants. No, this
Mac
is unfair.
Williamson would be their next star outfielder.
Put the Padres in here.
He had it. Oh, you're lucky you don't break your neck.
It was hard to watch.
Oh, wow.
Williamson running full speed after a foul ball, tripping over the bullpen mound and into the sidewall. He suffered a concussion, and he says the effects of that head injury still linger.
You know, concussion's effect can last a really long time depending on the severity of the concussion, your genetic predisposition, how soon you have another concussion or injury to the head. This is why we really try to discourage athletes from returning to sport too soon. The way we judge between an appropriate time or too soon is based on symptomatology, how they're feeling, how they're performing. So if you're back to normal, not having symptoms, that's a good sign that you're good to return. But a lot of athletes will sometimes hide those symptoms in order to return sooner, putting themselves at risk for a more serious injury down the line.
Off the end of the bat, cool shot. Can anybody get to first? Machado's going to beat everybody. Beckham went over to get it. Machado fell down. Did he turn to second? They're going to tag him, but he's hurt. Oh, my gosh.
Remember, through mechanism of injury, we can oftentimes see and predict what the injury is. Based on where the force is coming from, where the body weight is going, we can see which ligament or muscle or bone is affected. Could be a terrible triad type. It looks like his ankle is really bad.
The bag and his knee went inward.
He suffered a torn medial patellofemoral. Wow, okay, so that's really unique that happened for him. And the way doctors make this diagnosis is a few ways. One, we're looking at the mechanism of injury. Two, we're confirming with the physical exam. And then three is imaging, specifically MRIs. And a lot of times you'll see people get x-rays first. In some instances, that's due to insurance companies saying you need to prove that there's no bone issue. Remember, x-rays only look at bones, whereas MRIs can look at soft tissue, connective tissue, like ligaments, tendons, etc. So we'll get the x-ray, rule out any bony pathology, then move on to the MRI showing us the soft tissue injury or potential injury. This is a celebration, so I don't know how this is going to go wrong. What is happening?
Hopefully Edwin Diaz isn't really hurt.
A lot of times what we don't realize with athletes is towards the end of games, when celebrations are more likely to happen, there's a high level of fatigue, especially in the supportive and protective muscles. And when there's that high level of fatigue, you don't have the same shock absorption, protection from injury, natural reflexes that kick in order to prevent further damage from occurring. Mets general manager Billy Epler announced Thursday that Diaz will undergo surgery and is likely to miss the entire 2023 season. Diaz suffered a complete tear of his right patellar tendon. The issue that I see more so in younger athletes that the patellar tendon starts to impact is something known as Osgood-Schlatter disease, where the patellar tendon that attaches to the tibia actually pulls on the bone so much, and while that bone is developing and is a little bit soft, it creates an inflammatory pulling effect on the bone, leading to inflammation and pain within that bone. It's a condition of adolescence, but I've seen it continue into early 20s for some of my patients, especially ones that are more likely to be physically active.
Here's the set. The 3-2 pitch, a wild pitch back to the screen, scoring from third.
Did you see how fully tear there?
It's ball four, and Saunders is hurt. A wild pitch because something in his arm snapped.
He was diagnosed with a humerus fracture, which is an upper arm fracture. Very unusual for that to happen. I mean, in an average healthy adult without trauma, I would be worried about a pathogenic fracture, a fracture happening as a result of some sort of bony process like a cancer.
Stop taking meeting notes and let ClickUp AI Note Taker do it for you. It allows you to focus on your meetings, not your notes. It captures everything, from action items to key decisions. And after every call, you get a clear summary.
In the air to shallow left. Long run. Look out!
Oh,
Abrams makes the catch, but cleats go into Profar. And both are injured.
Jurickson getting looked at his jaw.
oh, God, knee to jaw. And the knee is such a strong bone. The knee is actually not a bone. It's the femur meeting the tibia, sitting with the patella on top of it. The San Diego Padres, an outside outfielder, Jurickson Profar, has been diagnosed with a concussion and a cervical neck strain after colliding with a teammate. Cervical neck strain is just the musculature of the cervical spine, which is the top portion of the vertebral column. Remember, the vertebral column is made up of the cervical spine, the thoracic spine, the mid-spine, the lumbar spine, the lower spine, the sacrum, the really lower spine, and then the final coccyx, which is the tailbone. We used to have vestigial tails, but we outgrew those. Or we ungrew those, probably a better term.
Boys will be
Matches.
boys. A hot one has been scheduled.
Is that
We shall
a
await
firecracker?
further development. For Scott Van Slyke, well, Adrian certainly set it on fire. Something smells wrong in here. What is it that smells? Ah, now we found it.
Don't light your teammates on fire. That's good advice. A burn, especially in that area, is going to make it really tough to do anything on the field, let alone run or pitch or anything.
Solomon Torres facing Sosa in the fourth. Sosa. Oh, wow.
Wow, and he hit him in the temple. That's a very dangerous area to get hit. That's a soft spot. That's gotta hurt. Not good.
Adam Jones inadvertently damaged some pretty expensive equipment. The mid-home RoboCam is out of commission. Wham!
Oh, that's got to be a TikTok. Someone make that into a TikTok. You know, when you post a video and everyone's thinking that they're watching really intently, then boom, that always messes with me. How about reacting to NFL injuries with the Brandon Marshall? Click here to check that out. And as always, stay happy and healthy. We've reacted to all sorts of sports injuries, but hockey injuries, I know these are about to be tough. I'm excited to diagnose. Let's get started.
Zach Cassian's pass now. Finally Reaches. Larson. Short. Backhand centering pass. Cassian. Russell lets it.
Oh my God, did he get hit in the face? You know what I always do as a doctor in these situations is not only look at the player, I also look at the ice. Why? Because blood is very visible in the ice.
One-timer right here by Russell.
Slow motion, slow motion.
Net. And right there you can see.
Do they wear cups? I don't know enough about professional hockey. Do they wear cups? I mean, blunt force trauma of the scrotum like that can easily end up with the testicle ruptured. You get injury of the tunica albuginea. That requires ASAP surgery. Even if the testicle ruptures, as long as surgery is done properly and the repair is done within like 3 days, you have 90% chance of saving the testicle. Then there's some situations where the damage is so far gone that surgery can't help it. And in those instances, you may have to perform an orchiectomy where you remove the testicle in its entirety, which is usually okay because you could still be fertile with a single testicle and have enough testosterone production as well. Oh, did he get hit in the groin also? Why is everyone getting hit in the groin?
Gregory Campbell dove in front of a 90-mile-an-hour shot by Evgeny Malkin. The puck snapped the smaller of the two bones in Campbell's lower leg.
He broke his fibula? The fibular head, there exists a condition called like a fibular head dysfunction where the fibula doesn't move in the correct pattern. That can cause significant pain. This guy completely broke it, and he's still skating around trying to prevent a power play goal. Oh.
We got a good look at Braden Shen's injury in the last shift. He comes in, he hits Zubers. It is the skate that comes up.
Oh!
Across the stomach.
That's a pretty mean scar. I mean, that's like... He looks pretty benign, I'm not gonna lie. But that could have been really bad, because if that went a little bit deeper, that cut, that could have been easily the colon. The large intestine sits right there in that pocket. Here, this looks like a scab. Like a mean scab, but a scab.
On March 11th, 2000, Leafs defenseman Brian Berard was accidentally clipped in the eye by the stick of Ottawa Senator Marian Hossa. Berard suffered a retinal tear and later a detached retina.
A detached retina is ocular surgery instantly. Some of the classic symptoms of retinal detachment is like a curtain falling over your vision so you cannot see, floaters, flashing lights, etc. But this is a condition that warrants urgent evaluation.
In the 2001-2002 season, Berard returned to action with the New York Rangers and thankfully was able to play 6 more seasons in the NHL.
Speaking of the Rangers, my buddy Jacob Trouba, who is the captain of the Rangers, recently has an art exhibit that he invited me to, but I couldn't go because I was in the hospital. But we did hang out at New York Fashion Week. Check out our picture here.
McSorley is out there as well. Oh, McSorley.
Oh, did he hit his head on the ice?
It caught him in the helmet.
Oh, is this a concussion? Oh, no. Oh, who does that? The temple is a really tough area because you have the semicircular canals right in the ear. That's where your balance center is. Also, there's a little soft spot there as well that can really do some serious damage because the suture lines are right there.
In a rare criminal conviction for sports violence, a Canadian court today found suspended professional hockey player Marty McSorley guilty of assault.
Wow, they charged him with assault? That's incredible. He was sentenced to 18 months probation. He didn't get jail time, but still, that's a serious crime.
First period, I'm coming around the net. Craig Ludwig slashes me in the thumb, breaks my thumb in 2 places. Split second later, literally no more than half a second later, Darian Hatcher comes flying, throws a high elbow, jumps into my head, and breaks my jaw in 4 places.
Oh my God, can you imagine breaking your hand and your jaw simultaneously? You need a hand specialist. You need a facial reconstruction specialist, like a maxillofacial physician.
My doctor came in and says, we can keep you here, you can get your jaw fixed here, or you can go back with your team and get it fixed. I flew home with no painkillers, couldn't drink, couldn't eat, spitting into a cup. I went through 2 cups of spitting blood because I was literally severed inside my mouth.
Why was it worth traveling with a team to not get that fixed? I don't get it. I want to celebrate people who are tough, but when you're just being macho to be macho and you're putting your health at risk, I got to point out the flaw in that mentality.
It is one of the greatest nights in Southern California hockey lore, and it's one he doesn't remember.
On his stick, he moves it.
Oh, that's a bad hit.
It looks so bad. When he was almost 1 minute, like he didn't move any. There's no movement. It was scary.
Yeah, in those situations, you want to keep them as immobile as possible in order to get their C-spine stabilized, to get them off the ice in a safe manner. You never know what is damaged surrounding the spinal cord. Sometimes unnecessary movement can do more harm than good and actually can end up paralyzing someone.
Leveled by, and he's He's had cushion problems in the past.
I don't remember anything live.
I wouldn't have helped him off the ice. I would have gotten the backboard. That's just too strong of a hit.
When I saw that hit, I said, there's no way he can come back. These days standards, he would never come back and play again.
That's unnecessary. Again, that's that macho mentality that's going to cause someone to become permanently disabled or just miss a couple of games. Like, the risk is just not valuable. Remember, when you lose consciousness from a concussion, that means your brain's experiencing massive inflammation, massive damage, and it's in a vulnerable state. So to go out on the ice and risk getting a second concussion is putting yourself in a situation for permanent brain damage.
Steve, I just want to apologize for what happened out there. That I had no intention on hurting you. And I feel awful for what transpired.
Is that because he fell on him and his face hit the ground first? 3 fractured vertebrae in his neck with a grade 3 concussion, vertebral ligament damage, facial cuts. Wow, amnesia. There's just like a lot of neuro injury from a single accident. That's what happens when you get knocked out and then you start falling, only to have someone land on top of you in the process.
What is your health like right now? I still have a bunch of things, but headaches and lower energy than I used to, and requiring more sleep, things like that. Obviously, it's hard not to think about the most important thing that I can't do, which is play.
I don't know how they deal with these criminal situations, because like in hockey, isn't fighting celebrated and that's part of the sport? And then you hurt the person, is that considered a crime when that's part of the sport? That's like saying boxing, you punch the guy and then you're going to get arrested. I don't know, like it's tough to wrap my head around.
Incident occurred with 7.5 minutes to go in the first period. Yuri Fisher suddenly slumped over while he was on the bench. Immediately, the Wings began calling for medical aid. The fans and the players looked on in obvious grave concern as medical staff administered CPR, and a defibrillator was brought onto the scene.
So if someone's heart stops, you can't feel a pulse, they're not breathing, they're unconscious, you start CPR, you get the defibrillator, you point for someone specific to call for help, and you get them medical aid, because you need advanced cardiac life support, which requires medications, perhaps surgical interventions, etc.
What happened basically is Fish was out in a shift. He came off. He was standing there with his teammates or sitting on the bench, and he had a seizure and he fell forward and then ended up on his side. And right away, as soon as we got aware of what was going on, we got stopped and we had medical help right away. They started doing CPR on him.
Not everyone who experiences a tonic-clonic seizure requires CPR. If they're actively having a seizure and their muscles are working, there could be a situation where they still have a pulse, but it may be difficult to feel in those situations.
But they hooked up the auto defibrillator is what it's called, and they shocked him. And, the heartbeat that leads to death, they got that stopped and going. And they continued with the CPR, and our medical staff obviously did a phenomenal job.
So when we put on the defibrillator on someone's chest, what it does is it analyzes the heart's rhythm to decide if it's a shockable rhythm or it's a non-shockable rhythm. Flatline means no shock advised, keep doing CPR, wait for medical help to arrive. If there are some shockable rhythms, then it says shock advised, everyone hands off, shock delivered at 3, 2, 1, you press the button, and it delivers the shock, hopefully stopping the heart and restarting it in the correct rhythm.
Greg Adams with a puck, and he shoots it wide of the goal. What incredible. 11 seconds to go on the penalty to Paul Martin. Erik Karlsson's been banged up. He's really hurting, too.
I can't tell what's going on. He's knee? ACL? I don't see blood. That's a good sign.
Let's take a look. Oh, skate.
Oh, did a skate go into his calf? On February 2013, Karlsson's Achilles tendon was lacerated. Wow. He returned just 10 weeks to the day. Wow, he must have not had a complete laceration, but still, that's an incredibly painful injury. And the Achilles tendon attaches to the calcaneus. It's basically the extension of the gastroc muscle that allows attachment to the bone and really, really strong propulsion of the lower body.
A seemingly normal game between the St. Louis Blues and the Buffalo Sabres stopped in forward as goaltender Clint Malarchuk goes down, bleeding from his neck.
Oh no.
Inch laceration that partially severed the jugular.
Oh no, I'm looking at the ice like I said earlier, and with the ice, I see what I don't want to see.
When the players scramble, the team's medical staff rushes to the ice. But Malarchuk was fearing the worst.
You want to put pressure on that area. Rapid evacuation to a surgical center.
A former combat medic and the team's athletic trainer kept pressure on the wound.
Good.
He stayed by his side as Malarchuk was rushed to the hospital.
Right. I swear I've never watched this before.
1.5 liters of blood and 300 stitches later, Clinton Malarchuk seemed to have pulled through.
Wow, what a life saved.
After surgery to repair the damage last night, Malarchuk was up and about today.
That's incredible.
Clinton Malarchuk had just survived one of the worst moments in NHL history.
That's incredible that he survived. To get the jugular vein cut that has so much blood supply to it is truly, truly incredible. Wow.
I started to have flashbacks. The nightmares were the worst.
Wow.
I'd be sound asleep and I'd see that skate come up, and I'd wake up straight up in bed.
I mean, he's describing symptoms of PTSD. And, you know, in common tongue and in common language, we talk about PTSD as if it's not as serious. We need to be very careful with this condition because people who truly have PTSD suffer greatly. And I feel when we use that term lightly, we make light of their struggle. These hockey players are survivors, but these people survived gruesome accidents, incredible stories of survival. Click.
It's pass now. Finally reaches Larson. Short. Backhand centering pass. Cassian. Russell lets it go.
Oh my God, did he get hit in the face? You know what I always do as a doctor in these situations is not only look at the player, I also look at the ice. Why? Because blood is very visible on the ice.
One-timer right here by Russell.
Slow motion.
Net. And right there you can see.
Do they wear cups? I don't know enough about professional hockey. Do they wear cups? I mean, blunt force trauma of the scrotum like that can easily end up with the testicle ruptured. You get injury of the tunica albuginea. That requires ASAP surgery. Even if the testicle ruptures, as long as surgery is done properly and the repair is done within like 3 days, you have 90% chance of saving the testicle. Then there's some situations where the damage is so far gone that surgery can't help it. And in those instances, you may have to perform an orchiectomy where you remove the testicle in its entirety, which is usually okay because you could still be fertile with a single testicle and have enough testosterone production as well.
Checked by Ferris. Puck forced along, but walked on by Malkin. Moves in and fires home.
Oh, did he get hit in the groin? Also, why is everyone getting hit in the groin?
Gregory Campbell dove in front of a 90-mile-an-hour shot by Evgeny Malkin. The puck snapped the smaller of the two bones in Campbell's lower leg.
He broke his fibula? The fibular head, there exists a condition called like a fibular head dysfunction where the fibula doesn't move in the correct pattern. That can cause significant pain. This guy completely broke it, and he's still skating around trying to prevent a power play goal. Oh.
We got a good look at Braden Shen's injury in the last shift. He comes in, he hits Zubers. It is the skate that comes up.
Oh!
Across the stomach.
That's a pretty mean scar. I mean, that's like... It looks pretty benign, I'm not gonna lie. But that could have been really bad, because if that went a little bit deeper, that cut, that could have been easily the colon. The large intestine sits right there in that pocket. Here, this looks like a scab. Like a mean scab, but a scab.
On March 11th, 2000, Leafs defenseman Brian Berard was accidentally clipped in the eye by the stick of Ottawa Senator Marian Hossa. Berard suffered a retinal tear and later a detached retina. Rangers, and thankfully was able to play 6 more seasons in the NHL.
Speaking of the Rangers, my buddy Jacob Trouba, who is the captain of the Rangers, recently has an art exhibit that he invited me to, but I couldn't go because I was in the hospital. But we did hang out at New York Fashion Week. Check out our picture here.
Well, McSorley is out there as well. Oh, McSorley!
Oh, did he hit his head on the ice?
And caught him in the helmet.
Oh, is this a concussion? Oh, no. Oh, who does that? The temple is a really tough area because you have the semicircular canals right in the ear, and that's where your balance center is. Also, there's a little soft spot there as well that can really do some serious damage because the suture lines are right there.
In a rare criminal conviction for sports violence, a Canadian court today found suspended professional hockey player Marty McSorley guilty of assault.
Wow, they charged him with assault? That's incredible. He was sentenced to 18 months probation. He didn't get jail time, but still, that's a serious crime.
First period, I'm coming around the net. Craig Ludwig slashes me in the thumb, breaks my thumb in 2 places. Split second later, literally no more than half a second later, Darian Hatcher comes flying, throws a high elbow, jumps into my head, and breaks my jaw in 4 places.
Oh my God, can you imagine breaking your hand and your jaw simultaneously? You need a hand specialist. You need a facial reconstruction specialist, like a maxillofacial.
You need a dental team.
Doctor
You
came in,
need
says we can keep you here.
more
You need
than
your jaw
that.
fixed here. or you can go back with your team and get it fixed. I flew home with no painkillers, couldn't drink, couldn't eat, spitting into a cup. I went through 2 cups of spitting blood because I was literally severed inside my mouth.
Why was it worth traveling with the team to not get that fixed? I don't get it. I want to celebrate people who are tough, but when you're just being macho to be macho and you're putting your health at risk, I got to point out the flaw in that mentality.
It is one of the greatest nights in Southern California hockey lore, and it's one he doesn't remember.
On his stick, he moves it.
Oh, that's a bad hit.
It looked so bad. When he was almost 1 minute, like he didn't move any. There's no movement. It was scary.
Yeah, in those situations, you want to keep them as immobile as possible in order to get their C-spine stabilized, to get them off the ice in a safe manner. You never know what is damaged surrounding the spinal cord. Sometimes unnecessary movement can do more harm than good, and actually can end up paralyzing someone.
He's had crushing problems in the past.
I don't remember anything live.
I wouldn't have helped him off the ice. I would have gotten the backboard. That's just too strong of a hit.
When I saw that hit, I said, there's no way he can come back. These days standards, he would never come back and play again.
That's unnecessary. Again, that's that macho mentality that's going to cause someone to become permanently disabled or just miss a couple of games. Like, the risk is just not valuable. Remember, when you lose consciousness from a concussion, that means your face hit the ground first. 3 fractured vertebrae in his neck with a grade 3 concussion, vertebral ligament damage, facial cuts, wow, amnesia. There are some mean crashes in NASCAR, F1, Indy, and we're gonna watch some of the meanest ones. But know that everyone survives in the clips that we're about to watch, and we're gonna talk about the medical situations in each of these scenarios. Also, huge thanks to ShipStation for sponsoring this video.
Distance ahead.
We got Formula One action. Honestly, the Surviving F1 series is fire if you haven't watched it yet. Where would his body be? It looks like it would be split in pieces. And the fact that there's a fire. I mean, he's in a fireproof suit, but how long can that help for? Oh, there he is. He's trying to get out. Oh my God, you gotta spray him. See, the problem with spraying down directly the person is it's good and bad at the same time. Good in that you're dousing the flame, but the reason you point the fire extinguisher at the base of the flame is to literally suffocate the flame. And when you're shooting it at a person's face, it essentially starts becoming flexed, and you're gonna need multiple surgeries usually and occupational therapy. Shout out to my occupational therapists out there to help work that hand open and keep its strength or recover its strength. Wow, he's walking away from this? Not even walking, my guy's running away from it.
Not only has he survived going through a barrier at 160 miles an hour.
160 miles an hour? How is he not concussed going from 160 miles an hour to 0 so quickly? The brain sits in a soup, so it starts hitting the front of your scalp when you come to an abrupt stop. And I know they have neck stabilizing devices in the car, but whoa.
He's insisting, no, we'll get the ambulance here. But he wanted to demonstrate that he was okay. He got a message to everyone, his wife and family in particular. That
okay, beautiful message. Medically, I hate it. Adrenaline in moments like this is rushing so fast that you might not have any idea what's going on in your body. You might be bleeding internally. You might be bleeding internally into your skull, having a stroke. So many things could be going wrong right now, and just to symbolize that you're great and strong, you do the extra walk, unnecessary. Actually, it's the same reason in boxing, once there's a knockout, they don't have people just usually stand up right away after the match ends. They first bring them to a stool. They have them calm down in the stool, and they evaluate what's going on there, and they have the doctor speak with them. Then they have them stand up, and then they redo it again. And there's reasons for this progression because we want to make sure that the body and mind are both safe. Looks like he only suffered minor burns to the back of his hands, a sprained left ankle, and was discharged from the hospital soon after. That's crazy that that's all that happened. I mean, I sprained my right ankle.
90% of open teaching positions are created by teachers who leave the position.
Oh, what the? Rib shattered, scary skull fractures, and full-blown infernos. Today, we're reacting to some of the most insane, bone-breaking crashes and medical scenes in F1 history. Let's dive right in. Oh!
You are flying and you are bouncing around, and you see the sky, then you see the ground.
You can see attached to his helmet, you have this device called the Hans. The whole point of that is to reduce the whiplash when you get into an accident, reducing injuries to your neck, as well as like other fractures like a basilar skull fracture.
Then the car stopped. I saw a little space to go out, and I said I go out quickly. And my mom will watch TV, so I want to be out quite quickly.
Look at him, he's doing okay.
But it was quite a big one.
He's walking away from the accident, which is amazing, but it has been noted that there was a collapsed lung here and possible rib fractures. You can have a collapsed lung from blunt trauma to the chest. Most of the time, when you have a traumatic injury to the chest wall, a small fracture might happen. Thus, that fracture of the rib causes a small puncture into the lung. Oh! Oh my gosh. Thank gosh you don't see like a big explosion or anything like that. You just hear the noise of how fast these vehicles are going, 140 miles an hour, and then you're going to a stop. Your brain can potentially slosh around because your brain is surrounded by cerebral spinal fluid. There's something called a coup counter-coup movement where your brain kind of slides forward and backwards.
Counter-coup injury.
Bruising and injuries to the
Same
brain.
thing Dr. Mike said. Way to go, Doc. You were right.
This individual ended up getting a concussion, also had memory loss. Where am I? When we see people that come in with bad traumatic injuries to their head, they have memory loss or they keep repeating themselves. In the business, it's called transient global amnesia. Transient meaning it will go away. Global just meaning overall amnesia, can't remember things.
Luciano Berti gets too close to Irvine with the worst possible result.
Oh, that was a fast accident.
Irvine emerged unscathed and helped the marshals in the desperate scramble to get medical aid to the Brazilian.
This individual ended up with multiple facial fractures, concussion, and even a coma for a short period of time is what's been documented. How do you get facial fractures when you're wearing that helmet? Well, the helmet's not perfect. You still can break that helmet, cause compressive forces. Even the helmet can compress into the face. In your face!
Sensibly, the race is stopped, while Berti is transferred to a local hospital.
You always worry about facial fractures or Laporte fractures. That's a mid-face fracture. You also worry about a very unstable mid-face. Whoa! What the? Oh, he's getting jarred around. You see how the head
It's alright, babe. Just please, no more drama tonight. I'm sick of it. So please.
But when you're stiff
I can't deal with drama every night.
A lot of bad things happen.
It's
When
getting
you're
ridiculous.
relaxed, it doesn't have to fight against like your muscles and your stiffness, thus reducing the likelihood of bad injuries.
It's getting ridiculous.
Oh my gosh, look how the vehicle just like disintegrates, pieces everywhere. Airborne.
Thank you.
Why did the car go so airborne?
I'm not blocking anyone. Trent's my friend. I will not be blocking him.
Ah.
He's my best friend.
This individual came out with a concussion and a sprained ankle by trying to brace or stop.
I don't know why you try to get me to block people for no reason when he's not even doing anything wrong. If he wants to talk about me behind my back, I'm fine with that. Like, you know, sometimes people just need to vent. It's fine. I'm fine with it.
The car has gone through the barrier, you see. The car's gone through the barrier.
Car immediately in flames. Now you're worried about the blunt trauma forces as well as the burns. I believe he was stuck in the car for almost 30 seconds. Second-degree burns to the hands as well as some broken ribs. Second-degree burns have two different categories, superficial versus deep.
Sort of used as a wrench, as it were, to literally rip the car in half.
Wow, that's Roman Grosjean.
Unbelievable.
Wow. I see patients who come in, they can have tons of fractures to the ribs and can't expand their chest wall. It hurts like heck. And pain management and exercises to continue to take deep breaths so you don't get pneumonia.
He went hurtling into the path of the errant spring.
Oh.
And into the tire wall.
Oh. It's like a missile. The impact was so bad into his helmet that it literally caused a skull fracture and brain trauma and actually required emergency neurosurgical intervention. With skull fractures, sometimes you fix them, sometimes you leave them as is. This individual required plating.
The spring hit his helmet just above his left eye. and the car just went straight on.
Be careful, always wear your eye protection, not just from flying springs when you're driving, but safety glasses when, say, you're doing yard work, or when I'm at work and I'm doing a procedure. More common things that we see in the ER when it comes to eye injuries are people welding or little pieces of metal that get in people's eyes. Oh! What the? This person ended up, actually, I think died like many months later because of something called a diffuse axonal injury, subset of traumatic brain injury, where you're basically having a massive acceleration deceleration injury to where you're literally ripping your axons.
How much do you recollect of?
Did you see the head just flying around? This is 1995. They don't have the Hans, the head and neck support stabilization, so we're just free flying here.
I mean, they saved your life with a tracheotomy.
Oh, yeah. Oh. They had to perform an emergent field tracheotomy. We call it a crike nowadays, but basically meaning they put a tube in his neck. Then you have the cervical precautions that you need to do because of the head injury and the trauma that he took. So you have to make sure you're not moving around the neck so much.
The ER is an interesting place, but did you know there's an actual show that goes into the ER in the UK called Bizarre ER, and it shows everything. Let's get started. Bee-whoop.
We're heading to Northampton General, where Slack George student Holly Thompson has arrived at A&E.
That's emergency room in the UK.
Completely unable to close her gaping gob.
Oh.
As Holly can't really talk right now,
Probably best we tell you how she got here.
So in a situation like this, when the jaw is stuck open, some
Open
people call this
lockjaw.
open lockjaw. If you gently open your jaw, there's a very small amount of motion. When you open your jaw past a few inches, the jaw actually has to come down and out. And when that happens, the jaw can actually get stuck on a piece of this bony prominence that's on the skull, and as a result, end up in a situation like this. Because remember, the masseter muscle that sits there keeps everything tight.
Holly was at college, enjoying a particularly riveting lesson of government and politics.
Now I know why her masseter muscle was tight. I get stressed out talking about politics too, or learning about it.
Uninspired by the political
Ponderings.
ponderings, Holly
Open
opened
wide for a yawn.
I guess I would yawn too.
Her massive mouth
Maneuver.
maneuver
Caused her mouth to
forced her jaw to
dislocate.
dislocate, leaving her unable to close her cake hole.
Yeah, there's a little disc in there that provides padding, and sometimes that disc can almost be dislocated.
Literally speechless, Holly frantically
Nudged
nudged
her
her classmate.
classmates.
Try as she might, she couldn't help
Only
Holly
showed
shut
the
her
mouth.
mouth, and the pair
They
had no choice
but
but to interrupt the lesson.
A lot of those situations, panic sets in, and the musculature gets even tighter, and as a result, it's harder to move the jaw back into place. So what you want to do is try your best to relax, not flex the muscle, and actually move the jaw side to side gently to see if you could rattle it back into its place.
My name is Adira, I'm one of the doctors. Obviously, I can see your
Oh,
mouth
stuck wide open.
Has this happened to you before?
Kind of.
Sorry?
She said,
See, this is the situation where I go and get a piece of pen. This is a situation where I get a pen and a piece of paper to allow the patient to write so that they don't stress their jaw out further.
By keeping Holly's mouth wedged open with wood, the jaw muscles will get tired,
Unlock.
and allow the doctor
And
to
then
click
kick
her
the
laughing gear
back into place.
Again, what you're doing is you're trying to fight the pressure of the mandible, the muscles that are on either side of the jaw, and as a result, loosen the jaw down and back into place.
Relax.
Close your mouth.
Close your mouth.
That's it. Bite down. Finished.
That's it. Back down. Finished.
The doctor's digits
These
are
are
safe,
safe.
and Holly's jaw is back where it should be. And she's even got a souvenir of
There's
splints
splints
for the mantle.
I always love to see a happy outcome.
Darren had built his daughters a Wendy house. To finish the roof, he'd laid some tar sheets, which he was heating with a blowtorch.
Whenever there's a blowtorch involved and an ER,
I get nervous.
But Darren lost his footing, reached out to stop his fall, but instead put his mitt straight into the molten tar.
Oh, the hand is one of the worst places to burn. During a burn, and a burn to this severity, you're going to get contractures, which means that the skin tightens and forms scar tissue. When that happens with the hand becomes less functional. That's why in a situation like this, you need a hand specialist for ideal healing, as well as working with an occupational therapist.
Marks,
to make
can
sure
you please
find
get off my
motor movement
channel?
doesn't suffer.
I really don't need drama tonight. I really don't. After the day I've been through.
Red hot hands spiralling 6 feet towards the ground.
And he fell.
The relief he got from this roofing mishap was when he forced his boiled and blackened bits into the dog's bowl.
Yeah, in a situation like that, you don't want ice, you want room temperature water. Because remember, when you're going from extremes of temperature, going into room temperature water is going to feel cold in comparison to the heat that you just experienced, but also in comparison to your own
Hey,
body
Trent.
temperature. Remember, core body temperature.
Andy said you were talking about me behind my back.
When you go into room
Is that
temperature
true?
that's 70 degrees, it's going to be much cooler.
With the wound unwrapped, the troublesome tar has well and truly attached itself to Darren's palm. But he's lucky.
I mean,
Dunking
if it
his
is,
hand
I'm
in the
fine
dog's
with
water
it.
will have prevented more serious
Because,
scarring.
you
Removing
know,
the tar is tricky.
sometimes people
Its
need the vent.
consistency causes it to stick tightly to the
So
skin.
I'm fine with it. If you need to talk about me, it's fine.
Quickly, odds are that
I
skin
get
is
it if you
very
need to
damaged
vent.
and will
I
likely
get
peel
it.
off and fall
That's
off
what my
anyway,
channel's
and
for
by
anyway.
Doing that scraping motion on
That's why
tissue
my
that
channel's
hasn't
there in the
healed
first
yet
place.
could potentially cause more damage.
Graham smothers the hand in Flamazine, which will not only treat any infection, but will soften the tar, making it much easier to remove. 24 hours later, and Darren
And his sandwich bag are back.
It's throbbing.
Contractures.
Quite badly. It feels jolly tight now.
That's what the contracture that I
Okay.
was talking about. It makes it very difficult to move the hand.
The overnight soaking in Flamazine
Vina's
has
worked
The tar comes off easily, but the blisters have grown and are now ripe
for bursting.
What I'm going to do, I have to let the fluid out.
Right?
So you'll heal well.
Is that going to hurt?
Always like a Dr. V.
Your other hand is free. Just give me a slap. Okay?
A little humor in healthcare goes a long way. As long as it's appropriate. I've seen doctors miss the mark on that.
With Dr. D off to get the needle, Darren reveals a lifetime of phobia.
Up until the age of 14, I passed out at every single injection.
And you should never be popping these bits.
Okay, so Andy got mad at
Please
you.
allow
Okay.
a sterile
Hi,
and
Tina.
trained
Welcome
medical
back,
professionals
sweetheart.
To perform a procedure like this, especially on the hand. There's so many small structures that can get infected, resulting in long hospitalizations, needing
Yeah, it's
IV
9 races
antibiotics.
in one day.
Just don't do it.
Ooh.
And Dr. D is obviously
It's
from
one-
the school of thought
it's
that
9
confronting
races.
your phobia is the best way to cure it.
It is, but usually through a process of desensitization where you work your way to confronting the full phobia.
Blisters form to protect the skin underneath.
I'm okay. I'm not really feeling so well. I got woken up by a nightmare today.
Some of that pressure will
I had a nightmare where I was involved in a school shooting and I was shot 3 times. So needless to say, I'm not doing so well today. And I didn't want any drama on my channel tonight. I really didn't. So I'm trying to tell people who are going to cause drama to get off. I'm really not in the mood for drama tonight. I'm really not. So if you're here to cause drama, get off. Same with me. I'm glad I didn't have to go to the freaking ER because of this shit. It's ridiculous. I'm so mad at myself. I'm like, why did I do that? How did I dream of that? Why did it come up like that? I don't know. Like, I cannot deal with drama tonight. I just can't. We had a really rough rehearsal, and with my nightmare and everything, I'm just not in the mood today. So if anyone wants to cause drama with me, leave it until the morning. Please. Like, I cannot deal with it. Alright, save the rest of that for later. The rest of this can go in my soda bottle bin. Whew. Oh my God. Oh man. I'm so out of it right now. I'm so out of it. Oh man. Oh yuck. Anyway, let's go downstairs and get another lighter because I just lost my other lighter. So let's go and get another lighter, shall we? Oh, if I can just get up without falling this time. Oh, that's a nice lighting. Oh, yeah. Okay. Yep. Alright, whatever. I don't know. I'm not really that hungry. But, oh, thank God. We have root beer. We have Coke Zero. We have seltzer. We have root beer. Okay. All right. We have plenty to drink in the house. Perfect. I'll have to put those away later, but for right now, it's just, there's too much. There's way too much here. There's way too much here. Man. Oh, good. We got 2 new bags. Perfect. Okay, good. That's what I was hoping for anyway. I really want a lighter, but I'll have to wait until Dad's not in the, I'll have to wait till Dad's not in the living room. And we got another thing of ranch. That's perfect, because we ran out. We have a stuffing thing right here. We have some Jell-O here. We have another stuffing there. In case we happen to get stuck with the storm. I mean, it's good that my mom got another grocery order, because otherwise we would have been stuck without groceries, which is not going to be fun.
Or Paramount. I can't remember which one she said. What? 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 What is wrong with you? What? I'm just more cleaning than usual. There's water.
Usually when I'm more clean than you know something's wrong with me.
You want a beverage?
No.
Nothing?
I don't know what's wrong with me. I do need a lighter, because I don't know how, but I lost my other lighter and I was looking for it last night and I cannot find it. So, later.
I don't know how you lose these things.
It disappeared. I looked everywhere. And then, so we're supposed to have rehearsal tomorrow, but maybe we'll see. Dad said keep an eye on your emails, you know, by tonight or tomorrow, you know. Just be on guard in case rehearsal gets canceled. But they said everyone who's in that storm right now has already gotten 8 inches.
Yeah.
So, and that they're in like full lockdown mode.
Oh, where?
North Carolina. It's coming up the coast.
Oh, I know.
Yeah, it's coming, so.
I know from where it's coming.
So, this is what I have to take in the morning. Or we could just take it tonight ahead of schedule, but. I mean, I'd rather just do it tonight and get it over with, but.
You gonna do the dishwasher thing?
Oh, yeah, I'll do it. God, I'm like, oh, I feel so lightheaded too.
You know what?
I feel so lightheaded too.
Why?
I don't know, maybe it's just because of the way today went. It's just.
Maybe you need to eat.
Oh, I feel so lightheaded. What is going on? My blood pressure's been running a bit low on the lower side. It's been 109 over 69. Mm-hmm. And then it's been dropping to 106 over 69. I'm like, oh, that's really low. I'm like, no wonder I've been so lightheaded. Oh, no wonder I've been so lightheaded. Man. Mama. So, look at how busy February is going to be. Look at this. I know. So, come on. It's like, are you kidding me? It's like, we can't have one decent day. It's like, are you serious? Like, can't have more than one good day in this house? Like, oh wait, gotta make sure there's nothing in there first. There's not anything in there, so we have just reached 1 hour on my stream. So what is up, all y'all? Gonna try and invite my cousin one more time. I don't know why she's not coming. Normally she does come, which is bizarre. And it's Saturday, so where in the hell could she be? Seriously, dude. It's like, it's freaking Saturday. Join us for a Saturday stream. It's like, come on, bruh. It's like, you serious? Are you serious right now? Like, you're not gonna join me? Jack, 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 my princess, my girl, baby, honest to God, come on, here's a big girl. My hungry goo, my hungry goo. Baby, honest to God. Baby, come on now. Be a good girl. Be a good girl. Be a good girl. Come on now. Be a good girl. Be a good girl. Come on now. Come on now. Be a good girl. I got you. Mommy's got you. It's okay. It's okay. It's okay. Shh, 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 shh. It's okay, princess. Mommy's here. My princess. My little girl. My little girl. That's my little girl. Anyway, guys, I will see you guys in my next stream. Till then, I love you all. Alright.